Hi everyone, it's Lisa Moeller with MedMark and welcome to another edition of DocTalk. We're super excited today to be in our backyard here at Spirit Education in Scottsdale. And we have the privilege of having Dr. Jeff Rouse, a prosthodontist specializing in sleep and airway management, coming to us all the way from San Antonio, Texas. So welcome, Dr. Rouse. Thank you for being with us today.
Thank you. Appreciate it.
So tell us about what you do with Airway Prosthodontics.
You know, it's an interesting field, interesting concept, in that we've mainly focused on sleep dentistry. And to me, sleep dentistry is the fabrication of a piece of plastic and its impact on the airway. It's mostly for fat old men that have been diagnosed with having apnea and the heavy snorer type of patient. But there are a lot of people in the dental practice that have been ignored for years because they didn't fit that criteria and they didn't go through the medical issues. So I started as a prosthodontist to look at all the cases that came into my practice. So I have patients with erosion on their teeth, with bruxism, with malocclusions, with even abfractions, all those types of things. I started asking the question, could airway be a culprit in this and responsible for it? And sure enough, the answer is yeah, and a lot of them it is. So we gave it a different name. Instead of sleep dentistry that focuses on an appliance, we're really looking at the airway and its impact on the stomatognathic system. We call it Airway Prosthodontics. And in Airway Prosthodontics, we're going to start looking for earlier types of problems, in particular, 3 different types of patients. We're going to look for kids because that's where the real problem begins. Remember, sleep dentistry is about people that already have disease. We're going to try to prevent the disease. We're going to look at people with TMD problems. Young, fit females tend to show up in the office all the time looking for splints. Well, those are just airway problems, come to find out.
Right.
And then finally, we're also going to include the people that have the apneic issues, but we're going to try to do it in a little different way to maybe not have to go all the way to these appliances that will change bites and require medical intervention.
Right. So you're really breaking the stereotype on sleep apnea and airway problems with everyone thinking that it's 300-pound men. I mean, it really is. Anyone can have it. It's kids, fit people, overweight people. I mean, no one is immune to this problem, correct?
Right. So, and the idea behind Airway Prosthodontics came from the concept that sleep dentistry was missing some people that needed to be helped. See, sleep dentistry is about making an oral appliance, protruding the mandible, and you're doing it on the fat old man that already has apnea. They've been diagnosed by a physician, you're working through a medical model. Airway prosthodontics is really about the people that come into common dental practices all the time. So the restorative dental patient or practice is going to see people with bruxism, erosion on their teeth, malocclusions, all the way down to periodontal disease and abfraction. And the question I want people to ask is, could that be an airway problem? Because in fact, when we look at the data and we look at our patients, we're finding more and more of them are. So in the world of airway prosthodontics, we're not looking at the impact of an appliance on the airway. We're looking at the airway and its impact on the stomatognathic system.
So this is really a personal venture for you, isn't it? I did some research and found out that your son Jake had some airway issues early on. And tell us about that and how you got into it.
The reason I came to start thinking about airway prosthodontics and the impact that it has actually did come from my son. And the mantra in all of our courses is, who's your Jake? And by the end of the course, you need to be able to find him. Now, Jake doesn't have to be a kid or a grandkid, but it can be a mom and dad, a brother or sister, a husband or wife. But somebody in your world is going to be impacted by this. In my world, it happened to be Jake. And what happened with Jake is Jake was the colicky kid, the kid that would never sleep at night, the one that would throw up on you at the drop of a hat. I remember having to sneak out of his bedroom just in hopes that I wouldn't wake him up because he always would wake up so easily. He never slept in the same location in the bed. He always sweated while he was asleep. And we had 3 major surgeries before he was 6 years old trying to deal with all the ear infections and throat infections that he had. So Jake was my impetus for figuring this out. And unfortunately for my son, I was about 2 to 4 years behind what was going on in his world. I would see what happened to him, and I'd eventually read about it and say, I missed that. Well, Jake ended up having attention deficit and dyslexia, dyscalculia, dysgraphia, and some systemic issues and craniofacial issues that I am convinced today, if I'd been able to figure it out early enough, that we wouldn't be dealing with those issues today. Now, Jake's going to be fine, but it's still my goal to find your Jake and help you do that and start resolving it. Remember, though, it doesn't have to be kids. There are three main areas. It can be a child, but it also can be these young, fit females that we, as dentists, always see as the TMD patient, or it could be the old guy with wear and erosion on their teeth. Those are the three classic examples.
So, Dr. Rouse, you use a 6-step protocol when you teach airway management. So can you tell us a little bit about that?
So we call it the Seattle protocol, and we don't call it the Seattle sleep protocol or the Seattle TMD protocol. It's just the Seattle protocol because it's actually used on all of those patients, whether I suspect a sleep issue or a TMD issue, and we work through it. Now, in the classic way that sleep dentistry deals with this problem, it actually jumps all the way to step 6. What I'm figuring out is that if we start with training people to breathe better through their nose at night through some exercises, physical therapy, and doing dilators and caring for the nose, we have these unblocking exercises that can be done that in fact the data is suggesting that we can fix a lot of these people. There's really good research that's saying that moderate level apnea patients, if they just get breathing through their nose better, can essentially resolve themselves. So that's step 1. Steps 2 through 6 are just different orthotics that dentists have been making for years. Step 2 is a regular flat plane orthotic. 3 is an anterior positioning orthotic. 4 is a thicker orthotic. 5 is a thicker orthotic that moves them slightly forward. And finally, in step 6, we're to sleep dentistry where we actually protrude them beyond their normal limits. So by walking through all the different steps, you actually figure out where each person fixes themselves rather than just jumping to the end and assuming everyone needs the sleep dentistry appliance. Now, every dentist out there knows they've had patients come to their practice that you made a night guard for and they say, I can't sleep without this thing. What they were saying is not, thank God you got rid of my second molar interference. What they're saying is, I literally sleep better with this. So their resolution strategy was a flat piece of plastic that really doesn't change them anatomically at all, as opposed to the traditional sleep dentistry mechanism that can actually change the way they bite and chew.
So it was already working to begin with.
The system was working. We just gave them the wrong answer for the problem that they presented with. So we've just got a way of slowly working our way through until we find the appropriate answer for each individual patient rather than making everyone fit into the box. You know, that's the complaint that sleep dentists have had for years with sleep physicians. They say if I send my patient out to a sleep physician, all they do is put them on CPAP. Well, interestingly, the world of sleep dentistry has pigeonholed themselves today where all they do is make an advancement appliance that begins at 60% of the maximum protrusion and goes from there. You got to have more answers than that because not everyone fits that model.
So you guys, here is the cool thing about Spirit Education. All of this amazing information and Dr. Rouse's protocols for sleep airway solutions is coming to you live and in person. It's going to be really exciting stuff you're not going to want to miss. Dr. Rouse will be here this summer, August 18th and 19th, and back again this winter, December 15th and 16th. So get online, register now before these classes sell out. And you know what? Come find your Jake. Heck, we all know 5 to 10 Jakes who can be helped or even saved by this important information. Spirit Education Center just continues to bring you amazing information and protocols to make you more successful in your practice. How cool is this place? It just keeps getting better and better. Their state-of-the-art technology, hands-on training, and instructors that are above and beyond the best in their fields just never fails their doctor attendees. Again, for more information on these seminars and other dental topics, go to spiriteducation.com. And for more information on Dental Sleep Magazine, please go to dentalsleeppractice.com for more sleep-related information. I happen to think that we're just about the best source for dental OSA-related information out there, but I'm a little biased. Thank you again to Dr. Jeff Rouse for joining us today on this edition of DocTalk, and a special thanks to our sponsor, Spirit Education here in Scottsdale. We look forward to seeing you back here with us again very soon. Take care, everyone.